You are watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, the latest advancements in the treatment of pain, and specifically today about why you may want to choose an interventional pain management physician before you jump to drugs and invasive surgery. With us we have Dr. Amol Soin. Dr. Soin, welcome to the program.
Yes, thank you.
Now, I asked you, we talked about, I said, so what are your board certifications? And you said there are 4 pain certifications,
yes,
and you have boards in all 4 of them.
That's right. Yeah, there's 4 different entities that offer board certifications for pain management, and I took them all.
Okay. Now, and you're also, tell us about, you have a private practice.
I do.
And
yeah.
You're also you have a research
Correct.
center.
Yes.
And you've developed pain drugs.
Correct.
That
yeah.
are in clinical trials.
Yeah.
So tell us a little bit about it.
Yeah. So I also do research in addition to seeing patients, which I do pretty much every day of the week, but I have invented 2 different pain drugs that are non-narcotic. In other words, they're non-addicting. They don't make you tired or sleepy, and hopefully they'll be helpful in pain. And we'll see when we do the final trials.
Good for you. Now, and you're also the current president of the largest organization for pain management physicians, official board certification. I guess
yes.
It's recognized by who?
Yeah, it's recognized by many states across the country, but also the organization itself is called the American Society of Interventional Pain Physicians.
Okay.
And so what I do is interventional pain. Basically not prescribing drugs, avoiding narcotics, but finding a way to intervene to treat someone's pain. And this society was formed as a group of physicians that are fostering that and doing that all over the country.
So one of the things, and we've talked about this off camera, is your website. The website has a physician finder.
Yeah.
Because most people don't know what an interventional pain management physician is.
Yeah.
Is that correct?
That's absolutely correct. Don't know what it is and also don't know how to find one. Well, our website has a link on there where anywhere across the country you can click, you can type in your address or your city, and it will show you physicians near you.
So there's close to 5,000 of these interventionalists.
Correct.
Is that right? Do you call yourselves interventionalists? What do you call yourselves?
We call ourselves interventional pain management physicians.
Okay.
Yeah.
And I told you, I live on a street with a bunch of people in their 70s, wealthy guys, that all have had back surgeries.
Yeah.
And I asked each and every one of them, and none of them have heard of interventional pain doctors. So, and I've talked to one of your colleagues. He says that we should be first-line therapy when somebody has chronic pain.
Oh, absolutely.
Do you believe that?
I totally believe that, because surgery is a big gun, and a lot of times patients need surgery because there's no other options, but there are so many other things to try before you get there that could be very effective and allow you to function and move forward and do the things that you want to do in your life. Go to Costco, go for a walk, go gardening, or play tennis, or whatever it is. You can do those things and get your life back without having to have surgery.
So is it fair to say that an interventional pain management physician, your goal is to avoid drugs and surgery? But you do prescribe medications,
sure,
if necessary.
Oh, sure.
Is that correct?
Sure. I mean, look, when there's no other options, of course, we don't want people to suffer. So yeah, medications are an alternative. I think the important thing is to try other things first that may be effective or more effective than masking it with a pill.
So Medicare, Medicaid, insurances, everything we're pretty much talking about today, with the exception of stem cells, is covered by insurance.
Yes, correct. So pretty much all of the interventional pain management stuff that we do, except stem cells or some of the other regenerative medicine stuff, is covered by all major carriers.
So we're talking about neck pain, low back. What's the biggest? Back pain? People go to the physician for back pain?
Yeah, back pain is actually the most common reason why anyone goes to any physician for any reason. And, it will hit probably about 35 to 40% of us in terms of having severe back pain at some point in our lifetime that requires treatment. So it is a major medical problem. Neck pain is also very significant. Think about everyone on their computers now, working from home, hunched over, typing, looking at their cell phone, these types of things. It starts to cause this, kind of neck pain. We also treat other things though. Migraine headaches are a big issue. Real big reason why people don't go to work is because of headaches, abdominal pain. Honestly, anywhere you have pain in the body, there's likely something an interventional pain management physician can do for you.
Okay, now one of the natural ways, this is showing great promise, been around for a while, now it's becoming mainstream, is this spinal cord stimulation.
Yes.
What is it, and what are some of the conditions you use it for?
Well, spinal cord stimulation is actually a medical device. It's implanted into your body, and what it is it's a electrical wire or lead that ends up in your body, and it sends electrical impulses, right? And if you think about it, when you have pain, that pain signal is sent by a nerve. That nerve uses an electrical chemical signal to communicate to your brain to say, oh man, this hurts. This sends an electrical signal to sort of block or interrupt that. Or in other words, trick the nerve from not experiencing the pain. If we can interface with the nerve that's causing your pain, a lot of times we can actually modulate or turn that nerve off from firing a pain signal, in which case your pain's going to go way down.
So you're having pain in your low back,
right,
or possibly your neck. If you can find the nerve where that pain is being generated from, you put this lead wire, you point it in that direction or on the nerve.
Yeah, it's generally around the nerve.
Okay.
It's on the back part of sort of the spine area. The great thing about that, it's all done through a single needle stick in terms of inserting it to try it, to test it out.
And then their brain doesn't get the signal.
Well, that's the
doesn't
hope,
know it's
right?
in pain?
Yeah, that's the hope, right, is to interrupt that signal. And we know pretty quickly, right? I mean, you can come in through a needle stick, we advance this wire up in there, and then we actually connect it to something that looks like an iPad, actually, and we send these signals to interface with the nerve, and then typically patients will feel better pretty quickly.
So when they're in a consult, because you said there's a trial period on the spinal cord stimulation, they're on the consult, and what? You give them a test?
Yeah,
what do
we
you
test
do?
it. And that's what I was talking about. That's done through a needle stick. That's the testing phase. We test it. We try it out. We actually make sure it works. Because imagine that. If you have back pain, you go for spine surgery, you can't really test it, right? I mean, you have the surgery and you wake up and boom, it's done. And it is what it is at that point. But here in this case, you can actually try it out first and see how it's going to work for you.
So they're in the chair in your office or laying down. Do they ever say, my pain's gone?
Oh, oftentimes oftentimes when I'm testing on day one, by the time they leave my office, which we kind of test for maybe an hour or so to find the right algorithm or program or sensation for the patient, they'll tell me, oh, it feels better right away. But we actually want patients to go home with it. Right? We want the patient to go home with it and try stuff, right? Go to Costco, go to Walmart, walk around, do your activities, and then see what happens. Because that's what's important, is can you function with really good pain relief?
Now, for the ones it works for, it works really well.
Yeah.
Is that true?
I mean, look, like a lot of things, it doesn't work for everyone, but a lot of people get very significant life-altering relief.
And how long does it last? Could it last if everything works out?
Well, once the device is in and working, presumably if things aren't changing, it can just run continuously. We do have
like 10 years?
Well,
15 years?
We do have to put a little battery in to sort of power the device and systems, and there's a couple of those out there. But if that battery were to deplete or die, I mean, we'd replace that. That's a simple, maybe 5 to 10 minute procedure to actually swap it out, maybe a total of 30 minutes to do that exact procedure. About every 10 years. I got to tell you, there are basically two groups of patients that benefit significantly from it. Those who've had back surgery already and still have pain.
Like what? Like a fusion surgery?
Yeah, like a fusion or laminectomy. You have spine surgery and you come out and it just doesn't meet your expectations. You still have pain. And then you're stuck. Do you commit yourself to medications or do you have another surgery? I mean, that's a big step. Another option is to consider spinal cord stimulation. There's a lot of clinical studies on it rescuing what we call failed back surgery syndrome. The other group of patients are those that maybe they're not a candidate for surgery, medically or otherwise, or maybe they don't want to try surgery yet, or they're not ready yet.
Meaning what? Because they're too old? Maybe their BMI is too high. They
old,
weigh
too
much?
young, or they just don't want to go through a large surgery.
Okay.
It would be totally appropriate to try it and see if it's helpful. And like I said, the testing phase is very simple. A needle stick, try it out. A lot of times these are done in physician offices.
Is this a small group of the population, or are there millions of people that potentially could be helped by spinal cord stimulation?
Oh, there's millions of people that could be helped by spinal cord stimulation across the country. Maybe even in my home state of Ohio, actually. I mean, there's so many people that suffer from all sorts of pain that could benefit from this type of technique without drugs, without sedation, right? And sort of treating what's causing the pain, the nerves, right?
So as the president of this society of interventional pain docs, so what do you want them to do? You want them to go to the website,
yes,
get some of the education materials, go to the physician finder,
Correct. Going to the website is supremely helpful because you can find a physician through our physician finder in that website, and you can find a physician near you.
Covered by insurance.
Covered by insurance, right? But not only for what we talked about, for all sorts of pain, right? I mean, even if you didn't want to try neuromodulation, there's so many things that an interventional pain doctor does. Things like nerve blocks, nerve ablations, physical therapy, electrical stimulation, non-addicting painkillers. There's just a whole run of treatments that are out there and available to you that you can work with your pain specialist on to find the right algorithm for you. And the first step is to actually get in and see one of those doctors, and that would be to go to the website. And
do you keep people from getting surgery every day, like in your own private practices?
Well, I mean, certainly we do it all the time. And there are a lot of people, for example, that might be a candidate for a total knee replacement, and you know, that's a big step to take, but there are things that we can do for that that might be helpful to help prevent that from happening or even delay it a bit. But at the end of the day, it really fundamentally doesn't matter. If you have pain somewhere in your body and it's bothering you, I don't think you need to live and suffer with that pain.
We're going to jump next into some of these other procedures you're doing for pain. We're going to take a quick break. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, interventional pain management. With us, we have an expert on the topic. He is the president of the society, Dr. Amol Soin. Dr. Soin, welcome back.
Yes.
So, people that are afraid of medication, they're stuck on medication because it works for them.
Yeah.
And maybe medication is the best thing for them. You have these pain pumps.
Yes.
But when I hear about a pain pump, it seems like a more aggressive treatment, more medication. You say the opposite's true.
Yeah, that's definitely an option for people that may be on high-dose medications or be on a lot of pills right now. And honestly, it's getting harder and harder to write or prescribe those for physicians. And another alternative...
Like opioids, are we talking about?
Opioids, narcotics, those types of things. And another option is an implantable pain pump. And what that is you know, we put this pump underneath the patient's skin and it infuses medicine there. But it doesn't take as much drug as it would if you took a pill. So for example, you could take 300 milligrams of oral morphine, and that would be equivalent to just 1 milligram that comes out of the pump in terms of efficacy. So think about that.
And so the pump just kind of drips it on the nerve area, or where?
It drips medicine actually in the spinal area. That's where actually the nerves originate that causes the pain in your body. But this is an important topic because think about it. If you're a patient that's lost hope, right, and you've been to everyone, you've seen surgeons, you've seen doctors, maybe you've even seen my colleagues, interventional pain management colleagues, and you've done all of these things, and you still suffer. There is still an option to get you out of pain. And if you know somebody that's suffering and have tried everything, you know, a pain pump is a viable opportunity.
So it's actually less medication.
It's actually less medication, but there's a lot of options of medicines that we can put in the pump. The patients actually get a remote control so they can dose themselves. So if they're having a really bad day, they can push a button and then they can get medicine. There's actually a feature in there to prevent you from overdosing, so you can't hit the button 10 times and you know, overdose yourself. It's got a system to prevent that. But for that group of patients, the one that's tried everything, lost hope, and is really suffering, I mean, there's really something out there, and I think a lot of people don't know about that.
And I know, as an interventionalist, you're pretty stubborn when it comes to giving medications, especially when they're not necessary.
Right.
So is that almost like a last resort for you to give a pain pump?
Yeah, I mean, obviously we'd like to try other options first, and the big value of a pain pump, and that what I want people to know is that they really don't have to suffer with no options, right? At the end of the day, there is something out there that can help get you out of pain. Okay,
interventional pain docs, you guys give a lot of some of the earlier therapies, like nerve blocks, things like that.
Yeah.
Now, I know that there are RNs, you know, even here in this in our neighborhood, we've got these pain clinics that do injections all day long, and they're doing them, as you say, blindly.
Yeah.
You know, you point to your pain and they kind of go in that general area. That's not what an interventional pain guy does, and it's covered by insurance. So
yes,
if you're going to do it, you might as well go to somebody that is what? I mean, when you inject, you're doing it how? Tell us the difference.
Well, so we use image guidance, right? So we'll use ultrasound to see a nerve, or we'll use X-ray, continuous X-ray to find the area. And we just think about the level of education it takes to become an interventional pain management physician. I mean, from the time you graduate high school to the time you're board certified, on average, it's about 15 years of education to get there. I mean, that's a lot of schooling and a lot of training at a very high level. And I think if it's your body, you want that expertise. And considering it's covered by insurance, and a lot of times the billing codes for certain things are somewhat fixed, for your insurance dollar, you might as well go to people that have a lot of training, a lot of vetting, do it under image guidance. There's a safety factor there. And people that do it every day. I mean, this is what we do for a living, right?
Okay, good. We're going to come back more about some of the other procedures you're doing. I want to talk what you're doing for hip pain, sciatica, things like that. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, interventional pain management. With us, we have the president of the society, Dr. Amol Soin. Dr. Soin, welcome back to the program.
Thank you.
So, spinal stenosis, what is it? How is it normally treated by like orthopedic surgeons, spine surgeons, and how does an interventional pain management physician treat it?
Well, spinal stenosis is narrowing of the spinal canal. It's actually a part of aging process as we all sort of move through life. And I got to tell you, it's something that is so common. It presents as back pain, particularly with standing and particularly with walking. So people will say, gosh, I have to sit. If I try to walk 100 feet, I can't make it. I got to sit down and then my pain gets better. And it's funny because I notice almost every day of my life, right? If I go to Costco or if I go to Walmart, I'll see someone leaning over the shopping cart, kind of walking with that.
Okay.
And I almost want to go up to them and say, I bet you have spinal stenosis, or I bet you have back pain. Because when you lean forward and arch forward, or if you sit down, that pain gets better. So people naturally want to do it.
Why? Why does it get better when you lean forward?
The problem with spinal stenosis is space. Stenosis means narrowing, so there's not enough space there. The nerves start to get pinched.
And you're talking about the spinal
inside
column.
the spine itself, right?
Okay.
So as your back is arched and you stand and you try to walk, there's less space there, so it hurts. And you naturally want to lean forward because it actually is a way to create more space when your spine bones flex forward. It's a big problem, though, actually, and especially as people get older. I mean, they think of their golden years and they want to go enjoy things, and all of a sudden, well, I can't walk 100 yards because their back hurts.
So it narrows. And it pushes on nerves.
Yes.
So what do you do as a interventionalist versus what a surgeon might do?
Right, so the problem is space, so we need to create more space. And what if you saw an orthopedist, a lot of times they'll talk about surgical options, and a lot of times those are great, but it is invasive. It involves cutting out bones of the spine. Sometimes it involves putting in hardware because when you cut out bone, then the spine become unstable. So all of a sudden, it can be a pretty big surgery. So there are other things that we can do, right? Simple things like epidural injections can sometimes get some relief, which is just a needle stick in the back and a shot of medicine, usually steroid, to decrease inflammation and swelling within the spinal column, which will create more space. But there's another technique that is relatively new. It's called MILD. MILD stands for minimally invasive lumbar decompression, MILD. It's done through what we call a cannula, which is approximately about a centimeter in diameter or at the end of your pointer finger. So there's not a major incision or anything like that. But we go into the spine. There's a little tube. We have an x-ray camera that we used to see. And we actually, through this tube, we can actually pull out bits of the ligament that gets really thick that causes stenosis. We can pull out little bits of bone. In other words, we can create more space by doing that without having to undergo major surgery. So without a big incision, patients can go home the same day. And a lot of times they get results, almost immediately within a day or two.
So really no downtime? I mean, they can go home.
They can go home, really, after you're done with this. Small incision, and it's treating the actual cause of the stenosis, right? The thick ligament that's pinching.
She's just kind of
causing
cleaning it out.
Yeah, it's kind of cleaning out, going in there and cleaning it out. It's a very intuitive, if you have an engineering mind, it's a very intuitive solution to the problem. Space is narrow from bone and ligament. We take out some of that bone and ligament, clear it out, create more space, and it can solve the problem. Well, I got to tell you a cool story that happened to me. One of the first patients I ever did was actually, he was a reverend, a preacher, right?
Okay.
And he used to tell me that he couldn't sit on his pew and give his sermon because it was so painful. And he would usually like to talk for an hour, and he ended up leaning over for a little bit, and then came to the point where you have to sit down, and it came to the point where he couldn't do it anymore. And he came to see me because he had heard about this MILD technique. And I looked at him, spinal stenosis, we did a MILD. When he came back for his 2-week follow-up, I said, how are you feeling? And he said, great. Okay. So I was able to stand up, give my entire sermon, and I didn't even think about my pain. And that's it, right? That's the thing that's really impactful.
Now, to be able to see you, should they talk to their primary care physician? Should they talk to their orthopedic surgeon? or they can call you directly?
Yeah, I think they can reach out to physicians directly, right? And going to the website, Physician Finder, that's probably the most efficient way to do it. But yeah, asking their primary care doctor, can you refer me to an interventional pain specialist, would be a way to do it. Even looking on the internet yourself is another way to do it. But probably the most efficient way today, if you're watching the show, is just to go to the website and find it.
Now we're short on time, so what's another thing that an interventionalist may do that we haven't talked about today?
There's a technique called a nerve ablation that's been really handy recently, especially for joint pain, knee pain, shoulder pain, some of those joints that may have arthritis and degeneration. It's to the point where maybe you don't want to have surgery. So if you need a shoulder replacement, first of all, it's a bigger surgery, and you have a lifting restriction of 10 pounds for the rest of your life, and that could be challenging. There are ways that we can actually ablate or burn or cauterize the nerves that supply the shoulder joint so you can still function without having the pain, and that might be a way to avoid surgery.
And how long does that last, typically?
It is temporary, because when we do an ablation, basically we put a needle with heat near the nerve and sort of burn around the area, that actually grows back and heals, which is a good thing because it doesn't do permanent damage, but it's a bad thing because when it grows back and heals, the pain will return. So the range is anywhere on the, we expect to at least get about 6 months of relief with it. We could get as up to a year to year and a half, but it's a really easy technique, in and out of the office, all done through a needle stick. It does not take long at all to do it. But the key thing to know is in that 6 months, when you have pain relief, you can get back to function, you can get back to activity. Hopefully your pain will be well controlled, and you get that sort of energy boost, that vigor back. And the hope is in that time period, you can build up some of the muscles around the area, and your body could heal portions of it itself.
Okay, lots of questions for knees. We're about 3 minutes left. What are you doing for knees? And can you avoid a total knee replacement in certain cases?
Oh, in certain cases, there are a lot of options for knee pain. Of course, in some cases, when the knee joint is just too far damaged, I think surgery is a good option. But we do things like nerve blocks, where we can identify the nerves that supply your knee. We can inject medicine around there to try to block those nerves from firing pain signals. If a nerve block works, we can then do an ablation to burn or cauterize those nerves for more longer-term or sustained relief. And that's super helpful. Steroid injections can be helpful. There's a medicine called Hyalogen, which is basically almost a matrix, like liquid cartilage. Because the problem with the knee joint is you start to lose the cartilage, the bones rub together, and that's where you get that grinding pain. There's a technique where we can go in under x-ray guidance and actually inject some of this to hopefully sort of build back some of that cushion, that cartilage back. It's really exciting. And then, some of the new stuff out there, stem cells, regenerative medicine, it's getting a lot of attention. And
I told you I spoke to an orthopedic surgeon 3 days ago in Santa Barbara that says, I have a total knee replacement, and I'm convinced with what we know now about stem cells that I could have avoided it altogether. Do you believe that as well?
I do. I think in certain cases, it is a much better option to avoid surgery and try an interventional pain specialist. I mean, so if you're at home and you're suffering with knee pain, or you know someone that is, before you think about doing surgery, you might want to try something less invasive.
We're completely out of time, but you're big on education.
Yeah.
Go to the website, and as the president of the society, what have you done to the website for support for the public and for other medical doctors?
Well, so for other medical doctors, we have all these educational tools, but those could be helpful for patients too. Even though it's at a high level, a lot of patients are intelligent. They can understand and appreciate some of the educational topics out there. We have podcasts on our website.
So everything we've talked about today, there's probably a video that they could find on the website.
Yes. Yes, and it's a great resource. And you can learn a lot about these topics and actually hear from physicians talking about them. It's pretty helpful.
And you're proud of this physician finder.
I'm very proud of it because it is a mechanism anywhere you are in the country. If you're a patient or you know someone that's suffering with pain, can go there and find a practitioner near you.
And insurance covers it. So I know this is a big topic. I want to thank you for coming on the show. Final message, somebody watching this, because we've talked about this. The pain patient is not in the mood for change, not in the mood to try new things. They think they've tried everything. But if they've never seen an interventionalist, an interventional pain management physician, what do you say to them?
You don't have to suffer anymore. I would tell you that you don't have to be at home suffering and missing out on your activities of daily living or things that you want to do. Consider seeing an interventional pain specialist because it's possible we'd have an option for you.
Okay, good. Dr. Soin, thank you so much for coming on the program. Good stuff.
Great.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour. the leader in medical news with your host, Randy Alvarez, the authority on health issues.